documentation, the water fluoridation resolution compendium. And I think we all have copies of this, so thanks for bringing that.
Yes, my name is Justin Armand. I'm the Executive Director of Texans for Accountable Government. And I just wanted to say how grateful, Mr. Chairman and members of this committee, that we are as residents of Austin, that we are taking up this issue again. There are literally thousands of peer-reviewed scientific research out there since the 1930s that basically have been sort of filtered out of the narrative of the great health authorities here in this country. Actually, we invited a couple of expert witnesses here. They're the preeminent researchers, at least locally, Dr. Griffin Cole and Dr. Neil Carmen, and they're going to give very detailed presentations and cite these primary sources. In creating this compendium, if we filled this compendium, or if we gave you resources of all the primary sources, it literally wouldn't even be able to fit in your office. So we just wanted to get your hands on some of the primary sources cited in the resolution so you could see them for yourself. And in terms of the cons for local Austinites, just one thing I'd like to mention is that it's ostensibly for children. However, at the 0.7 parts per million level that we have here in Austin, our children, babies through breast milk are getting 175 times the fluoride levels through breast milk that they would. So when in breast milk, it's 0.004 parts per million. That's the natural fluoride level of breast milk. So many people reconstitute formula with tap water that's fluoridated. When they do that, they're getting these babies are getting 175 times the recommended EPA dosage. So that's one major con. And then also there is this paradigm shift that has been mentioned here and cited, and the scientific paradigm shift was in the 80s when you juxtapose systemic fluoride versus topical fluoride. So in the 1950s, Mrs. Troxler was asking about the historical context. It was believed universally that because of the way that the data was being looked at, that the benefits of fluoride were through ingestion, that children, the pre-eruptive stage, or the stage when the teeth were still, or the early stages, it would change the biochemistry of the teeth before the teeth had erupted, and most of it was believed back then that it was systemic. Well, now since the 1980s, it's believed that it's topical, right? So if you look at the research of fluoridated versus non-fluoridated, when you look at here, many of the European countries, they don't even fluoridate their salts. So if you look at the research over 5 decades, the trend was already going downwards in terms of tooth decay. And the American Dental Association, the CDC themselves, published statements across an array of scientists. It's absolutely conclusive, even by the proponents of fluoride, that the primary benefit and primary mechanism of action of fluoride is topical. And fluoride is universally available now through toothpaste, right? So it's not even conclusive that that is lessening tooth decay. However, to say that it's a public health concern, the science has already shown that it isn't. And then also in a recent publication by the Department of Health and Human Services on the prevalence and severity of dental fluorosis, even within the range, they've concluded that in the United States, adolescents now have, 41% of adolescents have now dental fluorosis. And if you look at the moderate to severe fluorosis cases, it's now up to 4%. So it's increased 18% since the last survey in the 80s. And then in terms of the moderate to severe cases, it's more than doubled, right? So the Dr. Dean, DDS, the guy that he was primarily responsible for the clinical trials in the 50s and the 40s, which led the Public Health Service to endorse fluoride, he even stated that if there were a water fluoridation program, that even this causing mild fluorosis would be absolutely unacceptable. So I'd like to now introduce one of our panelists, Dr. Griffin Cole. Dr. Griffin Cole, he's a graduate of the University of Texas Health Science Service in San Antonio and has been practicing biological dentist, mercury safe and fluoride free since 1993. He achieved fellowship status in the International Academy of Oral Medicine and Toxicology in 2008, authored the Academy's fluoridation brochure and scientific research review on ozone use and root canal therapy, and currently serves as the Academy President. He's been published in numerous national dentist publications, including Contemporary Aesthetics and Dentistry Today, for both his cosmetic work and his commentary on dental issues. His most recent publication, Treatment of Biophosphonate-Related Osteonecrosis of the Jaw with Oxygen Ozone Therapy, published in May 2003 in the Journal of Implant and Advanced Clinical Dentistry, is the first documented case reported showing complete resolution of an osteonecrotic lesion utilizing only ozone therapy. And I'm sure all of us know exactly what we're talking about right here. Dr. Cole has also been featured on numerous television and radio news spots, including World News Tonight with Diane Sawyer for his expertise on water fluoridation and dental mercury issues. And did we want to give the panelists each time, or are they going to be kind of working together? Shall I introduce both of them now?
It's up to you.
Let's start with Dr. Griffin Cole's presentation. Thank you very much.
Thank you, council members. I appreciate the time here to come and speak about something that I'm very passionate about and have been talking about for about 2 decades now. The title of my slide, I don't feel is exaggerated at all, and the science will back me up on this, and my partner, Dr. Carmen, will touch on a lot of the science very soon. Those of you who don't know, it's not a nutrient, it's not essential for health. No study has ever shown a disease state where they lack fluoride. The actual fluoride that's added to our water, as was mentioned earlier, is hydrofluorosilicic acid, which is a waste product from the fertilizer industry. It's not sodium fluoride, it's not calcium fluoride, it's not the same animal at all. The silicofluorides, if you look at all the science on it, and it's been looked at for about 50 plus years now, is really damning on how it gets through the body. It's not handled the same at all. This is the one way that you can get fluoride over the counter is toothpaste. And even that has a warning saying don't swallow it. So we're taught in dental school that it's the panacea. And I believed that the day I graduated and did for even a couple of years. But after looking into the science, I realized that this was not the case at all. That and just right here, the actual toothpaste that you would use, they warn you that if you swallow more than a pea-sized amount, to go see a poison control center. So the one type of fluoride that you can actually get over the counter, you're not allowed to swallow either. These are some examples that you've already seen probably in several handouts of what's happening really to our Austin kids, and I've got a slide here, I hope that shows up, that shows actual Austin kids with fluorosis. When you asked earlier about what were are there any cons to it, and she said not really at those levels, that's not true. Even as low as 0.7 levels, which they both just said that we've had for many years, Austin kids that are born and raised on Austin water have fluorosis. 41% of them do. And the reason why they lowered the level to 0.7 was not because they thought it seemed like the optimal level now, it's because of this issue. There are too many kids that their teeth are ruined from drinking fluoride. And mind you, that's the only effect that drinking fluoride has on teeth, is a deleterious one. It's not beneficial. You can drink it all day, it has no effect on your teeth whatsoever in a beneficial way. Topical is the only means of actually being effective. There's some Austin kids here. A couple are from my practice, one's from another practice here in town. Kids that were born and raised, we verified it from the parents here in Austin. This is the comment that we hear all the time, right? It's water fluoridation is one of the top 10 public health achievements of the 20th century. It sounds really impressive. And we hear it all the time from all the Surgeon Generals and everybody else that speaks. But all you got to do is go through the Freedom of Information Act to find out who actually said it. It's an economist and a dentist that are in the Oral Health Division of the CDC, which is a very small amount of the 14,000 members of the CDC. That's their names are Scott Tomar, who had never published anything on fluoridation, and Susan Griffin, an economist. They're not toxicologists. 2 of 30 people in the Oral Health Division. So when you hear that statement, just realize where it actually came from. It's not that damning after all. This is their actual position, by the way. These are quotes from the CDC. Fluoride's predominant effect is post-eruptive and topical. Why this is so important is that fluoridation is all about pre-eruption and systemic. This is the exact opposite of what fluoridation is supposed to do. Here's another comment as recent as 2012. We are unaware of data about the additional protection from tooth decay that could result from consumption of fluoridated drinking water. These are quotes that you can find. We've got everything documented. We've got all the citations for you. So you can find all these comments here. What does the FDA say? The FDA classifies fluoride as unapproved drug, and they've never approved any fluoride-containing supplements or over-the-counter drugs. This is as recent as 2005 commentary from the FDA. What does the World Health Organization say? I had to actually circle where our country is, because here's the deal. If you look on that graph, the top, I guess it's about 14 countries there, do not fluoridate. They're unfluoridated. The bottom 4 are fluoridated. Look at the difference. Can you tell me who's gone down in decay rates? Everybody has. Has nothing to do with drinking fluoridated water. It's across the board. And as you guys, I think, mentioned earlier, 98% of Western Europe doesn't fluoridate. And they don't all add it to their salt either. Sweden has no fluoride in their entire country as far as any kind of additional fluoride, and their decay rates are the same. There's no difference. So this new safe level, which has already been touched on several times, so I won't waste any more time on it. Again, it was done because of the adolescents getting all the fluorosis. Bottle-fed babies. This is really why we're here. And he also mentioned this as well. It's way more than what human breast milk has. There's a protective mechanism in breast milk to keep fluoride at such a low level because of the harm that it causes. So here we are. How do you control the dosage? I mean, as adults, we drink way more, water, and yet we get less exposure than a baby that is bottle-fed, where 80% of their diet is water. And in East Austin, maybe where they can't afford to go buy spring water all the time, or whatever areas there are, that's not fair. They have to use tap water. This was a warning that was sent out to us, members of the ADA, in 2006, and this was shortly after the NRC came out with a really great report, which Dr. Carmen will touch on. But look at this. It says, if liquid concentrate or powdered infant formula is the primary source of nutrition, it should be mixed with water that is fluoride-free or contains low levels of fluoride to reduce the risk of fluorosis. This is from the people who think fluoridation is wonderful. They're actually telling us as dentists what to tell our patients. This is huge. This is Mosaic. This is the company that sells the hydrofluorosilicic acid to Austin. And I want you to look at, I made it larger because it's so hard to read, but this was their MSDS sheet, which was changed in May 2011. This was right after that warning came out saying, let's lower to 0.7. And that whole warning is geared toward children. This is a information sheet about their product. Workers, staff employees, adults who look at this. This has nothing to do with children at all, yet they're doing this warning. And the reason why they're doing it, it takes all liability off of them. As soon as it gets into our tanks here in Austin, now the city of Austin is responsible. So if any kind of litigation goes on down the road, with, oh, my child was ruined by this water, Mosaic's out of it. It was very clever, actually, to include that on their MSDS sheet. One final comment here on this. This was a statement from 1979, and I show this because when you read this, I think we all get the same feeling as what's happening here. And it says, individual dentists must be convinced that they not be familiar with scientific reports and field investigations on fluoridation to be effective participants, and that non-participation is overt neglect of personal responsibility. I'm insulted by this because I want to look at the science and the field reports. I want to know what's really out there instead of just what I'm being spoon-fed. And this is the problem, I think, is a lot of my colleagues, with all due respect, they do what they're told. So, oftentimes we practice in these little blinders, and I like to look out. And the science is absolutely convincing and is getting more and more with all the new IQ reports that are out there. There's 41 animal studies showing lowered IQ in humans when they're exposed to water fluoridation. It just goes on and on, which Dr. Carmen will touch on. But one final comment that I did want to say is that, Austin has the St. David's Foundation, which has this wonderful dental van that goes to all the Title I schools, and we've treated thousands of kids over the past decade and a half with sealants and exams and cleanings and education. This is the way we lower decay rates. It's not adding an artificial silicofluoride to our water system. This is the way we do it. And I'd be willing to volunteer time on my own to give out toothbrushes or education, and I'm sure I have plenty of colleagues who would as well. We can't, our babies and children have no choice, but we do, so it's time to make the right one. Thank you.